Welcome, everybody. Thank you for joining us today. This is the third episode of the Decentralized Health track of SingularityNET's Decentralized OS web series. My name is Ray Dogum. I am the host of the Health Unchained podcast, where we talk about anything blockchain and healthcare related. And on today's show, we have special guest Dr. Eva Lee, Georgia Tech professor, and also has been doing research in the healthcare field for over 20 years. Before we get started with our interview, I just want to remind everybody listening here to subscribe to the SingularityNET YouTube page and also connect with us on social media. We have multiple different tracks running for the web series. And I think that this specific one, the health one, is super interesting to me, obviously. But I think the other ones are also very fascinating, and I think you should check them out. And with that, I think we can get started. Dr. Lee, thank you so much for joining today.
Well, thank you for the invitation.
And let's kind of just give the audience here a background on you a little bit more deeply, because I know you are an applied mathematician. You're currently a policy advisor. You've been in the industry working with the government for many years now, decades. So can you give the audience just a brief highlights of your career?
I'm a trained mathematician and computer scientist. And after graduation, I started my first job at Columbia University as an assistant professor. And I was really fortunate. I was trained by the doctors there in medicine for 3 years. And so that's how I really marched into the field in medicine and like, I guess since the 1990s. And I started working with industry at that time. And so the policymakers are really private sectors. And as you could see, they are pretty eager. If they see that things are working and that it's good service to the customers, they're more eager to make changes. And so a lot of successes with the private sectors. And then I started engage in pandemic work in 2003 on SARS and avian flu. And it's really, and working with CDC and yes, involved in some of the advisory level for policymakers in the local, state, and federal level. And I think it's really rewarding. It's very different because it's such a in a sense, you talk about decentralized. It is really centralized because there are many different groups of people you work with, and everyone is in charge of different things in their local jurisdiction. So you work directly with them, and truly the policy itself, how it is being formulated and how it meshed into the final form, I think it's a lot. It's very fascinating, a lot for me to learn, and it's very different from private sectors. But yeah, that's how I get started.
It's very interesting. And when you mentioned decentralized, I think of the current state of the COVID pandemic. And I also think of how our model in America works. We have 50 states. You can count some other territories as well. But let's say we have all these states that are all doing somewhat different policies. They're enacting different policies to control the pandemic based on the people that live there or the leaders of those states. In your experience, do you think that's an effective model? And although it is sort of decentralized, how do you feel about the way that they approach the problem?
I think it's really challenging. Even for us, even before COVID itself, as you notice, yes, it is in the United States, the healthcare is very decentralized. And unlike England or Canada, where if you have an innovation in cancer research, for example, where you roll it out, you could roll it out to the entire country. Whereas it doesn't work like that here, right? So it's really every state is responsible for certain things. The local jurisdictions could also play a key role. And you see that really highlight perfectly in the setting of COVID. The governor say we're going to do this, and the mayor say no, we're not going to do that. And so you have two leaders fighting, even though they all have good intention. And so I think a lot of times we spend so much energy in fighting, and maybe that makes it really ineffective. I think that part is truly difficult, I think. For COVID, there's multi-layer challenges. Even look at face masks, right? A national level of face mask mandate. Actually, that was set forth by the Biden administration just for federal employees and stuff. But then as you roll down into different states, and they don't have to follow, right? So that's like the governor can, and then you roll down more, and the mayor say, well, we don't have to follow that. So I think it's inefficient at the very core. And for COVID, I think it exposes the intrinsic difficulty, and when we need every single person to act in a kind of unified way, right? I mean, I think COVID really demands us to band together and all march together in the same mortality or same mentality of like, okay, let's work together. Let's all social distance. Let's all compliance with hand washing and face mask and all this. And that is a big part of it that will work. But because of all this not uniformed way of governance, then and also choices that you can make, then it makes it really difficult. I think the mandate of by one leader could be overwritten by another leader in the same jurisdiction, right? So I think that makes it really difficult. And on the other hand, like it could be also, if you look at innovation or if you look at other things, it could be advantageous to be decentralized, right? As we know, giving them more flexibility and allowing them to use their resources that they have and innovate and come up with the best solution that is suitable for what they're facing on the ground could be a very positive, way to solve a problem. So I see both positive and negative side of it, except like, of course, when it is so critical, when life and death becomes like in seconds, right, where you have to decide that, then it becomes really frightening because we don't know which side is going to win out, and we don't know what is going to happen, and we don't know like what is the next step, right? So all of this uncertainty add up to anxiety. So I think like there's no one size fit all. I would say there's positivity to it, and there's definitely we see negative part of it, and it's a difficult situation. But then you look at Germany, like it is in a sense a more centralized government, right? I mean, if you look at it, but on the other hand, it's really not quite centralized because they also have 16 different quote unquote states and area, and everybody could do and make their own decisions also. So I think it's like, I would say every single country has its own challenge, and ours may multiply. It's just because, there's just so much more like mixing it with politics and so make it a little bit more, how do you say it? A lot more fighting involved because like we lose track of like fighting the COVID-19 because then we're fighting among each other, right? So that's a little of the distraction involved. Yeah.
Yeah, anytime you involve humans, there's ego that comes into play sometimes. And we've seen that throughout the last year or so, over a year. You can think about some of the states declaring that they don't have to have masks on as a point of pride, right? Like our state doesn't require masks. So it's quite interesting. I think what's really important for these states and even small local cities is to look at the data in their region and area. I think that might help them at least make a strategy or create a strategy that would be most effective for them to either control the any spread that they might have. Because in some rural areas of America, it's not that as widespread, let's say. And then I think some people are thinking that's an excuse not to worry about a mask. I wouldn't say it's an excuse, but maybe it helps guide the restrictions. Like maybe they don't have to be locked down, but they still need masks, but they don't have to close all the bars and restaurants. So there's a way to use data in order for us to make educated decisions about what to do. And I think that's what you focus on. That's your primary job. Or one
right. Yeah. I think data, somebody likes to say that COVID-19 is the first pandemic that is data driven. So yes, in that sense, of course, there are a lot of disasters that we rely on citizen data and everything, but COVID truly, there are so many sites set up, like the government, right? Government data source and private citizen data source and local and jurisdiction. And I totally agree with you. I mean, in the sense that I run all these predictions for the 3,000 jurisdictions, like counties that we have. Yes, indeed. You could see like local jurisdictions could make decisions about face mask and social distancing and opening or closing of business. based on their, the pandemic situation. I totally agree. And then there's also an issue about interdependency, right? You could be doing really well within your own jurisdiction, but then your neighbor jurisdiction is on fire. And so you are interconnected, and that becomes really important. And then that's why you see some of the governors, they band together and then they decided, okay, we're going to do this together, right? So it's the state and understanding, because there are so many travels and business connections and movement of individuals and across all these neighbors. So you can really, in some sense, sealed off and say, well, look, I'm a closed system and this is what I'm going to do and it won't affect others. So I think it's a little bit more complicated, but yes, definitely. I think people need to really look at their infection rate and really make a sensible decision, because like you see what is in the news now, right? You see Michigan, like between the 20 to 49 years old people are the one with the highest hospitalization rate, right? So, and that in fact, there is like between 30 to 39 years old, there is like over 600% of hospitalization among those infections. So it's a huge percentage of people. So these should give us an idea of what's going on. And if you look at the infection of the state, it is escalating. So this is real, right? You can't deny. You cannot just say, well, yes, I'm going to go to bar and I will be okay, because you are not going to be okay, because the data is not lying. And those, at least those are synchronized data that are shared by many different people that everybody agreed that is what they're seeing. So yes, it is a little like for us as a scientist, I think it's really comforting, because huge amount of data now. So we can complain. It used to be everybody complained about, oh, I have no data, I cannot do anything. Now we have lots of data. But the idea is, can you make smarter decision or risk-informed decision using the data, so that the data has to be visualized in such a way that people understand, right? Because you and I understand it. Like you can give people data and people look at it and they will have different ideas, because it is not like they look at the data and they come all to the same conclusion. So I think it is important to present the data in a way that is conducive to understanding what exactly is happening, so that when people say, here's the action, and then they say, yes, this is the right action and I'm going to follow, right? So those are all important.
It's a good point. Just having the data might not mean the information people glean from it is the same. It's very important to have someone who understands statistics and also can represent the data in a way that's meaningful to them and the communities. We previously talked in a different time about the different types of data that are being generated now. Specifically, one interesting one was wastewater that you mentioned to me, and how that's being tracked more frequently in different places. And I can imagine that continuing to happen for not just COVID, but for many diseases that we see, for flu in the future potentially. So it's interesting that the interest of doing that has increased so much due to COVID. That's a good thing in a way. It's a silver lining from all of this. And yeah, do you want to just comment on those efforts and what you think about them?
I think, it's very interesting about wastewater, because that's actually fall into one of the things, like for the past few years, I have been looking at medication, like over medication, right? So like in the United States, we talk about like not just opioid type drugs, but even antibiotics. People are given too much medication. And so one of the things I look at is really how does all these medication actually being funneled into the wastewater, and how would that affect the ecosystem? Because when wastewater go out, right, to the streams, and after the treatment, like of this wastewater, what is the percentage of these medications still stay in the water? And how would that actually arrive at the, outside, and that animals and plants actually absorb those? And how would that affect human? So I have been very passionate about that. And that's like spend the last few years looking at those and trying to collect water source from hospitals and from different sources. So then all of a sudden, right, COVID came about, and amazing is that truly, if you look at the local wastewater, it really tells you a lot of things about what's happening, right? All the chemicals, composition, and viruses and stuff. It gives you an idea about the epidemiology stuff, the surveillance of like disease spread and everything. So I think the wastewater itself is a good idea to track because it is not just for COVID. Absolutely. It's really for all sorts of diseases. It's like I say, it could also be tracking over medication, right? Of different communities and different hospital source and of data. But now to give you an idea why this is really amazing, looking at what is going on. So look at this Houston, right? The city of Houston. In January, they are thinking that, well, the COVID cases are dying and maybe they can get back to normal soon. And then February 8th, they discover about 53% of their wastewater treatment has the UK variant. And then 1 month later, on March 8th, they discover 79% of the wastewater treatment plants have the UK COVID variant. And now if you look at the Houston infection rate is escalating. And so is the mortality. So it serves as a really good way to track what is going on and an early sign of things. But I think that's only one thing because we also have talked about is what actions do you do, right? I mean, look, we see all these warning signs, but if you don't take any actions as a policymakers, what is going to happen? And what actions are you going to take? When are you going to take it? Those are all important. So I would think that like with the ability to track all these things, then there has to be a guideline or a certain type of things to say what triggers an action. What is the timeline? Under what condition are we going to act? Or else we'll still be wait and see, right? I mean, that's basically what has happened early on to us, at least in the United States, and that basically downstream effects now we know is devastating. But in the same way with the UK variant, now I think, when I was sounding the alarm, that was pretty much, I think late December 2020. And about the variant, that of course I was hyper alert because every time if England say they have it, I'm sure we already have it. Right? So, but people were very calm. They said, no, we are okay. And now you see what is going on. 20% of the new cases are the UK variant. So I think this is real. And I'm most worried about is the Brazilian variant because it is very deadly, highly infectious, a lot more infectious than the UK one. And also it is not responsive to some of the really good treatment that we have been using. So that's really bad. And I'm just seeing the news about the Indian that they have double variant. And I don't know what that meaning, like what exactly does it mean? If it means that it is more infectious or more deadly or what is going on. And I think we're still waiting to see what is happening to those. But yes, it seems like we need a lot of different levels of biosurveillance. But then most importantly, we also need a clear understanding of what is going to be the action in response to those discovery, right? I think that's very important.
So yeah, I'm also very concerned about the variants, and I'm wondering the current vaccines that we have, and there are a few, I think like 3 or 4 that are available. We haven't tested those vaccines against the new variants. I mean, it's being tested in real time, but it's still not good enough, I think. And if we do get a variant that is completely ineffective, would that be possible? Is it possible that one of these variants just don't respond to the vaccine, or the vaccine doesn't really help? How likely is that?
Yes.
From now.
Yeah, indeed. Yeah, indeed. Like, I think you asked a perfect question. Is that like even the Brazilian variant is already very disturbing because it is not responding to vaccines, the existing vaccines, and it is highly infectious, and it is also highly deadly and not responsive to the current treatment. So that's actually even more so, right? If you get the virus and in Brazil and this new variant, basically your treatment chance of success, of treatment, is very low, and that means the high mortality. That's what we are seeing, and the South African variant is also very disturbing because they also were unable to get very good treatment out of that. So I think our current vaccines seems to work really well. with the, existing variant, and I cannot tell about the UK variant. And it seems to me that they still say it has efficacy, or with the new variant from UK pretty well. So that's good. But other than that, the Brazilian variant, the South African variant, absolutely not. And then there is the Danish, right? The variant from Denmark that is really deadly to the animals. And then there is a new double variant from India, which is still a lot of unknown to those, but then it is suspected that it could be highly contagious and that may be very deadly or very difficult to treat because of all these combination effects. So I think it really troubles me because there's so little to understand, but we are still in the midst of pandemic, right? So we could see the vaccination is so important. Look at UK and the rest of Europe. The rest of Europe is facing a surge that is worse than last summer. I mean, it's escalating the cases in Spain, in France, in Italy, in Germany. And now you look at UK, they have it under pretty good control because they just march forward with all the vaccines. In fact, they decided to use one dose instead of double dose, right? And that cover as many people as possible. And I thought that is a smart move because you could really see a difference. As you say, refer to the data, we could see a good, control of the infection in UK, which I think is very comforting. So that's their choices. What they have made, the choices are the right choice. And I think, I hope Europe will get back to the vaccination and that would be so important. I mean, I don't really want to see them have high deaths and everything because at the moment it's really devastating.
Definitely is concerning. And, I do have a question about the data and how it's collected. So if we think about some of the promise behind blockchain technology and decentralization and all that, and I know you're not an expert in blockchain technology, but I think it's interesting to talk to someone who's healthcare expert. Some people and individuals have this idea that the data shared by institutions, organizations might not be trusted all the time. This might, mean more for countries like, I don't want to name names, but maybe not the United States, but countries that don't have a well-developed infrastructure in place. And the idea is to use blockchain to secure that data and verify it, make it immutable so that anyone can go in and transparently see what the data is. That's the theory and the thought. And there are people doing this now, actually. So it is in play. What are your thoughts about that in terms of...
So it's very interesting that you asked about the data. Now, I thought, I have to say, I have gone through so many disaster or crisis, right? So H1N1 and Haiti operations, Japan and all this. And I have to say the data that we have now for COVID is one of the most impressive ones. Part of the reason is because a lot of this data is collected by really citizens. And the world data that I looked at that actually give you information about testing through different countries. And they collect those data and they put it all into a form where you can all access to it. And then Europe also has the open data access to hospitalization and cases per capita and all of these things. And those data, I don't think it used to be available. Those data does not exist in the past. So I think those are good. Now, are we able to collect data across the whole world? The answer is no. And you have already pinpointed that, right? Because it's not every single country is able to have those data. And we still don't have a whole lot of data from Russia. And we don't have much data from China. And we don't have a lot of data from many other countries, right? So I think those still needs to be collected. And with the type of data that we have now, it gives us some information, in terms of vaccines, in terms of testing, and those give us a partial information of what is going on. Now, I think the blockchain capability is great. And I think that it's still, there has to be a group of collaboration across different countries, right? I mean, clearly we need that because without that, nobody could validate the data. The good thing I think is very interesting. Early on, I think last February, February 2020. So it's February 11th, exactly, 2020. So now at that time, the US was very calm, right? February 20th, February 11th, 2020, we only have a few cases, and most of the other countries are pretty calm too. But what is interesting is that I found the data online, and that's, I think, in South China Morning Post, that posted more than 44,000 patient data of different age group and the incidence and the mortality. That is amazing. Those data turns out to be so crazily useful because they reflect exactly what we found now. So I think the citizen science, and I think the journalists and newspapers like New York Times have data on GitHub. I think that's beautiful. And that would be like the future. Because I think GitHub is a very good place where we could access to data. People can validate what's going on, and they could make suggestions about changes, and they could confirm what is going on. So yes, I think all of those important. But there's a question also, everybody likes to think about, does data worth something? Right? Would that make, what is the value of data? To the scientists, to us, data is everything. And I think I have been really lucky because a lot of the work that I do, with the airline, with the oil industry, with the finance, I have real data. And truly, I cannot complain because a lot of even my colleagues, they have no access to data, and they ask, how do you get it? Well, okay. I think, right, it's a lot of you have to build a relationship. You have to sign contracts. You have to agree on confidentiality and stuff. But my feeling is one would question how much public data are we going to be able to allow, right? Or how do we validate public data? And how important it is. So my feeling is the public data has been extraordinarily important. So a lot of the predictions that I'm doing now for the 3,000 counties in the US and also around the world for other countries, I use all the public data, and they are beautiful. I mean, I cannot complain because they are really important data that can provide good basis for AI and machine learning and all the predictive tools that I build.
Interesting. You mentioned AI, and I had a question about that as well. And I'm wondering how, since you do work with many government leaders and you understand how policy is made and all the challenges with that, how are decisions made now, and how do you think in the future AI will actually improve the way our society makes decisions about public health?
Well, I cannot say I'm an expert in how decision makers like make decisions, but it's kind of interesting. At the end of the day, I think most of them truly believe in evidence-based decision. So that means it doesn't really matter whatever the evidence they have. They try to really make a decision based on those evidence they are given, right? So clearly, I think the science, if anything, COVID also has changed. Is that COVID has made science sexy and more appealing to policymakers, which is kind of, unexpected, right? Because it's nice to be a scientist or mathematicians, and people say, oh, great, they love mathematicians. Oh, that's a very nice thing to hear. So I think people are more eager now to embrace evidence and to look at prediction based on really algorithms that run on real data, right? So then that's where AI and machine learning comes in, because you can process large amount of data and make sense out of it and come up with certain recommendations that are sound and that you can validate and that it is based on evidence. So it's very comforting. So I think, but of course, policymakers are all different. Some are more eager to embrace data than the others. I also think they ask really good questions, right? Because they like to know, but this data is just part of the picture, but not all the picture. What if those data that we don't have are more inferential, right? So those questions are good to ask. But AI, I would say, is I see AI as part of, I know there's all sort of discussion. People think AI is going to take over humanity, but I see AI as augmenting our intelligence and our ability to make decisions, where AI provides some recommendations. You don't need to listen, right? I mean, you still have your own decision to make, but you look at those recommendations and decide, does it actually make sense, information, and like will it give me a better outcome? So I think that is how I would say AI would really enhance and augment the intelligence and the capability to make decisions, where you understand what the risk will be and what the trade-offs will be. And also, like, you can look at downstream effect, right? Because I think one of the things is you don't want to make decisions in which you don't really know what is going to happen. You like to be able to anticipate the positive as well as the negative. So you don't want any unwanted or unintended consequence. So I think that's one thing. The other thing, I think AI is going to be crucial and also clearly controversial. And we all know that it's like in face recognition, right? In face recognition, where we see the intrinsic bias because of the sample of individuals that are being trained in the sense. And we must understand that this is going to be a huge challenge. Like, I think the bias is there, is intrinsic. The question is not whether like we can handle like the bias. The question is, can we as a scientist be able to actually remove that challenge, right? Like eliminate that challenge, reduce that challenge so that AI not only just augment intelligence, but also being able to be fair. And I think that part is absolutely totally unknown at the moment. Being fair is, I mean, I remember, like I was in the airport, and one of those few ones that they use AI and look at my face, and amazing, within seconds. I mean, it was so fast that it actually come up with my ideas. I said, my God, it frightens me. Hey, okay. I mean, like, I didn't know that I am so unique or anything. But the odd thing is that, there's the part that they have to train. And my feeling is that, it's not just our facial structure, right? There are a lot of creatures or a lot of features and patterns that needs to be incorporated. And I think that is the challenge for AI. So I think currently the AI, like facial recognition, is based on a set of features that are really worked well for Caucasian population and stuff. And so we can use the same thing, right? We know pattern recognition. And I think that's the beauty when I look at machine learning, when I'm doing things. I don't just come up with one rule to make the decision. I come up with multiple rules. And you know why the beauty is? That's precisely, right? Different subgroups you could use different rule to establish the end result to be the same. That is the beauty. And I do believe that is going to require those work. We must be able to advance machine learning and AI in such a way that it could really identify different subgroups, identify different patterns, all of which are discriminatory, and that it allows us to get good answers. I think that has to be has to be a priority, or else there will be a lot of distrust. Because I think what COVID has exposed, one of the biggest thing that I think has exposed is inequity. Okay, we could say anything we want, about United States, and health inequity is clear. Okay, so that's and we always know because I work in healthcare, I work with safety net hospitals. So I know a lot of the people that don't have access to care, they don't have insurance, and they should have all of those, but they don't. Okay, but you know what is inequity? It's not just health, food inequity, food security. 12% of Americans do not have enough food. And that's before COVID-19. But after COVID-19, once COVID-19 came, it's a huge percentage of people. So I think that type of inequity is like COVID has exposed it, but how can we handle it? So if AI actually bring in more inequity, that's horrible, right? I mean, one of the things I think with AI is that I hope our scientific community will actually help to close the inequity by being able to build algorithms that would actually address all these differences and be able to help, to dispense service and to be able to identify things in such a way that this is equal and fair. And with that would be beautiful. I mean, that would be wonderful. And that's a real scientific challenge, but it is also one that is worthwhile to really to explore and to investigate.
And from what I hear in the news and a lot of technology media is that there is an effort to address this problem with bias in AI. However, that's what I hear in the news. I wonder what's happening behind the scenes in reality and what kind of competitive markets are building. Like, is there a real effort against this maybe racial bias with AI, or is the trend going away from that? Like, which direction are we heading actually in reality?
It's a little bit hard to, like, is there a coordinated effort? The answer is we don't know, right? I mean, so we don't really know. So maybe a better question then I would like to ask ourselves is, how can we actually do it in such a way that like we could even address that problem? How do we address that problem head on? And like, will that be like, so people like to say, oh, we didn't do well with the facial recognition because we don't have enough subjects. Okay, that's a good, right? That is a first step. But on the other hand, then I would like to challenge, how do you address that? How do you engage these communities so that they actually will be, they don't have to be the subject like of just testing. They could be part of the developers, right? I mean, like now I have a lot of kids that I trained and they are underserved population, and they could be they could be the nerds and the geeks in computer science, and they could be the one that is developing all these AI tools, and that they are able to see what the bias are, right? So I think all of these, we have to ask ourselves exactly what is the incentive for us. Like now, scientists like to pride themselves being able to, doing a really good job and doing things one of its kind, right? So, and I would like to challenge them exactly. Do this as really a challenge where like you could even set it out as a challenge to the community so that they would try to really advance the field and trying to understand what exactly are the bottleneck. Because until we are able to see and develop algorithms that truly are looking at the global picture, then we will always be like pigeonholed to the part where we can do well, right? So it is like, it's easy for people to continue to do the work where they are doing really well. It's very hard to navigate into an area that is different. And I think that's what the AI challenge is. And my feeling is we see a lot of like I say, the inequity is not just on that, right? There's so many inequities. So I think it opens up a lot of capability to innovate and to share resources and to collaborate. And so I think that's what we need to do. We could collaborate with the communities. We could provide them really with tools where they could advance it too, so that they can actually see what are the features and what are the patterns that we have to look for. And that would be wonderful. I think like that would be a win-win situation for both parties.
One of the topics I wanted to cover as well today was about public education. And I think this is kind of a part of that as well. Being able to help the public understand what AI even is and how it will influence our world, because it's already here. Most people can appreciate that, but not everyone really knows like how it's impacting their life. They might have their apps and tools like that, but it's still not clear yet. So part of the education, what would you say are like maybe the top 3 things that a normal person who's not familiar with computer science should be aware of to maybe help continue that conversation with people?
Yeah, I think, the education truly, that big piece is a big puzzle and also a very important ingredient. I mean, in terms of really filling in the gap about AI understanding. So one of the things I think it's like the public education that we must do, the first thing is really have access to the internet, right? I mean, you and we have internet connection for so many years.
We take it for granted.
We are one of those guilty ones, right? I mean, we have so much access to it that we don't realize that. Look at those the future. Okay, I look at the future generation as really the key. Okay, so the K-12 students. Okay, they are our future and they are the future leaders. Okay. If they don't do well, we all suffer. So I think the first thing first is that every single K-12 family, not just the kids, but the family have to have access the best access about the internet. And I think that, if I am going to build an infrastructure for this country, I would like that a free internet connection as an infrastructure. I think that not in the third world or other developing world. It is in the United States of America that we need that. And that's really important. I need every single one individual to have good connections so that they won't miss out, right? It's their choice if they want to be connected or not. But if they cannot be connected, then they have no choice, right? So that is not equality. So that's the first part. The second part really is now there's the mass virtualization, right? So you are absolutely right. Everyone have access. Like if they have access to internet, they also have access to, online courses and stuff. So I think that's the beauty, is that with that capability to access to the internet, then we could bring people. And I have kids that I will work with them. Every summer we work with each other. And I actually train them on AI and building all this, and they love it. I mean, these kids, they are just really bright and so young, and we make all sort of crazy things with AI and avatar, those things. I think that's really the beauty, right? When they could be interacting with it, they feel comfortable with it. And that is the next generation when you could really bring the equity together, because every one of them have access. So I think that's the second one, right? First, you need to make sure they have internet access. Second, they should have access to all the resources, being able to innovate and collaborate with the very best people, because now you could do it all online and stuff. And the next thing, of course, is that really being able to validate the implementation. So you are right. Everybody knows AI, right? If they have a phone, they know AI is at work and stuff. But you know what is strange about those? The AI at work is just that. As much as you think you're so close to the phone, really cannot do anything with the phone, right? The AI is doing everything, and you're not interacting with it and saying, hey, I don't want you to do this, but I prefer to do something else. So I think that interactive mode has to be opened up. So it has to be more open, and it has to be more integrated, active. And with that, I think then people would have a little bit more comfort, understanding, okay, this is something I could contribute. It is actually personalized to myself, right? Whereas it is not the case now. Not everything is personalized, and people don't really understand the usage. But we do know, it has been used, as we hear, right, from law enforcement, it's being used for facial recognition, and we know lots of false positive and stuff. So I think those feedback is good, but it also gives us information about there's so little interaction between the people that are developing the system versus the public, right? So I think the public has to be engaged in it. So, and like I say, the kids will be a good group to educate them and to teach them new knowledge, and to have them, to be part of the development and part of this interaction. I think that would be wonderful.
I agree. And I think the public, at least the younger generation, K through 12, maybe even younger, they're starting to interact with AI in terms of video and audio manipulation, and also generation. So things like on TikTok, where they're using tools to generate new audio based on their voice. I think that's one way that they like to engage, because it's interesting to them and it's immediately impactful. They're probably not super interested in predictive models about their health in the future, because, they're healthy. It's not a big deal to them. So that is interesting. I like those answers. So shifting to virtual society, which is what kind of we're doing slowly going into the future. There are certain things that happen to the human mind and body that might not be good, right? I'm talking about social isolation. And I think it'd be interesting to kind of just address that, because it is something that we are seeing more frequently, and it's definitely an impact to a person's health. And I wanted to know what your opinion is on this factor, and what you recommend, maybe.
Yeah, I have a lot of passion there about emotional wellness. And as you know, even if we look at the very privileged group, the college students, right? 50% of college students are depressed. And so emotionally, they are very fragile already to begin with. I mean, even before the COVID. And the mass virtualization really, in some sense, really created like an emptiness among some people, right? Because they no longer can hug each other. They no longer see each other face to face. And there are a lot of things that they cannot share. But the oddest part, I think this is the oddest part, because if you look at them, look at the younger generation and also the college kids and lump them all as younger generation, is that if you see them next to each other, they will be texting, right? They're not seeing it. They're not looking at each other. And if they are eating at the cafeteria or and what are they doing? They're texting each other and they don't notice the existence of the person. But then all of a sudden they notice it now because they cannot do it anymore. So my feeling is that, that whole concept of being together is all that it is, right? I mean, maybe you are sitting next to me. I don't talk to you because I'm texting, but that does not mean I don't care about you. But because you are next to me, right? That closeness, physical closeness is such an, how do you say it? Like natural, the feeling of being there and being supportive. So you don't have to talk to each other, right? So it's a different things. So I think, emotional wellness is going to be a very difficult situation because I think COVID has created many levels of suffering, right? So there are students, the underprivileged students that are not able to get education, at school. And there are people that feel isolated and that they don't have someone to connect to. And that being at home, it could be an abusive environment. And people emotionally are very fragile. And then on top of it, there's the job insecurity and health insecurity and everything come with it. So yes, I think that's going to be a huge hurdle for us. And it is going to last a long time. I believe that the emotional wellness and also mental resilience is going to be a big challenge for us. And we already see a lot of new business are coming up, those online mental health, institutes and stuff. So people are more eager to engage. And as you notice, they're engaging in a virtual way. So I think there's opportunity for us to figure out, because we can actually connect in a virtual way, then that means, the left out ones, even before COVID, right? There are people that are left out. How do we connect these people together? And, what type of resources do we have to create? AI could be a good way. And gaming, right? Gaming, we do a lot of those. And gaming not as a way to, clearly some people are addicted to games and that will be a very serious problem. But gaming in a sense of building a community and supportive community and helping each other to learn. And I believe in innovation. So I believe that, all of these we could innovate. And because now you can rally people that are far, far away from you and you could just, connect to each other and do things and share things. So I think we should look at that as a way of in a positive way, but there should also be resources that we should, provide them. So I also wonder, the geeks and the nerds are different, right? I mean, I like to say that is because I think in reality, it's true, right? I mean, we cannot deny the fact that the geeks and the nerds they're very used to isolation, right? If they're doing program, they would just be all night long. They're just all by themselves, but they're not really alone because they have their group of people that are connected, right? Through the, whatever channel that we have. So I think that is interesting. So we should explore those type of connection and understand. I would love to see, is the brain being rewired? Right? Through these virtual.
A lot of people say that, being isolated for a certain amount of time actually increases creativity. So it actually brings about new ideas that you wouldn't think about before because you're constantly being distracted by a person or something. Being isolated gives you that opportunity potentially.
Right.
Of course, you need to find that balance because if you're isolated,
Yes. I think the creativity could be really positive, but I think I'd like to know if cognitively we are exactly what is happening to our brain, right? The cognitive thinking. How do we come up with concepts and how do we communicate with people and how do we make these factors known to each other? So I always think there will be good things coming out of it, but on the other hand, of course, there are the emotional and emotional fragile group where they really need the human touch. How do, I was the one, I think it's really, I know, like, I think even 10 or 15 years ago, I complained. I said, I like to be able to touch because it would just be so convenient, right? I mean, one of those things that we build stuff is like, oh, can you smell? It's like, oh God, and I forgot. You cannot smell through the computer, but can you like touch? Like, can you feel? So
VR is like a pretty important factor because
exactly the virtual reality exactly, and we do that in the training of doctors, right? They were trained to do surgery. And they touch tissues and stuff. And those are just all on the computer. So I think there has to be more. I think there will be ways for us to connect people and being able to touch people through, on the virtual world. And that does not mean to to replace the physical world, because I think the physical world remain very important, but it is only as a supplement, right? So again, like as you asked me about AI, will AI ever take over us that we will become just a slave of AI? No, I don't think so. But I think some people believe it. I don't think that would be. But on the other hand, I believe it will be enhancement and augmenting what is missing and enhancing the process so that in addition to the physical world, we also have a more enriched like virtual world where people feel more connected. And I think that would be wonderful. And I think that would be a lot of advances that we can do.
Yeah, I hope so too. And I don't think there's going to be a terrible doom and gloom AI scenario, at least not anytime soon. But who knows? Yeah. Anything can happen in this universe. And one thing I wanted to mention about virtual reality is if you think about our experience working as knowledge workers now, at least we're sitting on a computer for most of the day anyway. So transitioning to a VR system is not that different. We're still going to be mainly sitting, but we'll have different ways to interact with technology. Instead of a keyboard and a mouse, we'll have maybe some wrist things and
more interactive. I think you point out one of the things. It's exactly the danger about people sitting in front of the computer all day long. Right? I mean, that's the exercise. I mean, like I say, some of us are used to it and we could compensate, have physical activities and stuff. But I think even that itself is probably not healthy, right? I mean, the whole concept of like sitting in front of a computer like 24 hours a day or like 90% of your time it probably will take a toll on the human health. So I think like the virtual reality and all of those are great is because exactly it's that you move around, right? I mean, you're not stuck to a chair anymore, but you are like everywhere and you are moving things and you are like physically active. And I think that is going to be one of the key things because I couldn't imagine that everybody's going to stay in front of the computer, because I think people do get fatigued. And the last thing I want them to do is to be glued to the computer just to watch things in a passive way, because I think that would be so not good for their brain. I think that's the most dangerous part.
Totally agree. And I think there's a lot of companies in the healthcare space coming out now with digital wellness sort of incentives. So mirrors that help you work out and all these different types of new innovative technology. So I think there's a huge need for that, and people want it too. So it's good.
Yeah.
I have one more like kind of question for you. I'm curious about. I asked many people that I interview this question. What are your thoughts around the AI singularity that is supposed to happen in 2045? We kind of addressed it, but I'm specifically the one kind of theory that Ray Kurzweil poses. Are you familiar with it?
Well, I guess, I mean, like if you're thinking about the thought that like discussion about AI is being developed to the point where it reaches a singularity beyond which it will continue to improve itself, right, without human health, right? I mean, would that happen? The idea is that the whole concept of AI, okay, you think about just machine learning, okay, AI and all this, is exactly that the machine is able to take the next iteration in a smart way, right? It is already quote unquote happening, but will it take over human? I don't think so, because I mean, like, you look at the Terminator, right? Skynet, and it wiped out the human. I mean, like, that's very extreme. But I think AI itself, it truly is assisting and it is advancing. And it allows us to advance faster because it is able to learn and it is smart enough to self-learn, right? And that's what I like. I mean, there were libraries that I created, which I call them self-learning, self-correcting library. As it learns, it figures out how to correct itself. I think that's all good and it is happening already. But I don't really think that it is going to replace human and become become leading us instead of us, it could be co-leading, but I also believe that, if you think about AI by 2045, I do believe AI and machines, will be involved in at least 50% of the household and workplace. So I do believe that it will control a lot of equipment, a lot of domestic processes, a lot of security issues. And what it means is that there will be a lot of bottleneck, right? Because we all know, we all know that, when there is all this automated process, and then all of a sudden a glitch happen, and then it brings down the whole system. So where do humans fit in? Yeah, we are going to fix those. Now, it is going to be maybe it will require more backup systems. I think there will be a lot more mirror systems I think we will need. And now, interesting enough, 2045. Let's ask ourselves this question. Can we overcome bias yet? Can we remove inequity at that time? You think AI will have that ability to lead us, or AI will actually cause even more confusion, right? Because now it's interesting. If you look at the pictures, I thought pictures are amazing, right? AI, don't even think about just the face recognition, but look at the fake news that you may not have visited, we may not have visited a certain place, but someone could put you into a position where it looks real and you cannot figure out if it is real or not. So can AI get to the point where we no longer can actually distinguish the real versus the artificial, the one? Because in that sense, that's exactly what we're trying to do, right? I mean, mimicking, when we do, treatment, when we do the, even looking at viruses, we try to create things that mimic the real one so that, we figure out how to, build up antibodies and everything. So that is good, right? We like it to be so close and so real, quote unquote. But would that hurt us? And, right?
Yeah,
I mean, there's all this challenge.
The point on deepfakes, was what you're referring to, is the ability to generate, videos or audio of people without their permission. That is, I think, solvable with using decentralized ledger technology. My idea would be that people would have to digitally sign off on any sort of content on the internet or anywhere. So in the future, I would imagine any sort of media at all, if it's not signed by the owner, should be assumed fake. That is going to be
That's very interesting. So you want a certification. Yeah, you want it to be certified.
Yeah, because if you think about it, as AI gets better, as our computing power increases and hash power increases, we'll be able to generate videos nonstop of people doing all these crazy things. And if we don't digitally sign it, we must assume all is fake. That is, I think, going to be the default. So anything you see on the news, as long as if it's not signed, certified and digitally signed on some sort of blockchain, we should assume that it is fake. That's what I think. I don't know if that's what's really going to happen.
Yeah. That is an interesting concept, and I think it's a good concept. But what if somebody faked that signature?
So, I mean, the signature would have to be coming from the person who has the private key to actually verify.
Yeah,
so
exactly. I think that is really
stolen,
the key.
And it could be stolen too. That's a very big concern, because someone can maybe steal your private key, or maybe in the future, a private key can be like a device and they can just steal it.
I think
there.
that's exactly, and that's what we talked about token, right, earlier, right? The token, the whole concept of if the data is real, and where does it come from, the source, and who is endorsing the source, and where, all of this, I totally agree with you. And hopefully we will come up. Now that system has to be universal, right? That's interesting. It could be, you think about decentralized, but on the other hand, if there's so many decentralized certification, you cannot figure out. So somehow, amidst all these decentralized systems, there has to be a clearing house where it will be able to say, yes, this is the authorized token of this individual and this is real and authentic. But I think, all of these is not too early to think about because we are already in some sense marching into that, right? As I say, AI is already doing a lot of those advancing steps. And yes, human is in the loop, but there are times we are not in the loop because as we run the code, the code is actually making decisions, right? It's not interactive. So I think all of this is happening. And so how do we govern and make sure that the authentication is real? And how do we actually store all these tokens and stuff? Yes, it is a big area, but it's a natural area for us to dive into because that is what it is anyway, the society. So.
Absolutely. And Eva Lee, really appreciate this conversation. It's been really fascinating. I think we covered a lot, health inequality. We covered a little bit about AI, talked a lot about COVID-19, the pandemic, the ways that data is being generated all over the world, and also the COVID-19 variants that are concerning. Anything else that we should cover for the audience here before we conclude?
Well, I think, it's kind of an interesting part about everything that we are looking at, is this social crisis, right? Social crisis and also advances. And that's the inequality in the internet, food, education, healthcare. And we touch upon really, what are these basic human needs, right? That's all that it is basic human needs. We also see that how much dependency we have, not just on each other as human, but also as countries, right? The interdependencies. Like you look at the supply chain, you look at all of this is intrinsically connected, but yet we see the inequalities across. But I think hopefully the technological advances, I hope will really broaden all walks of people across the globe and that it will bring down the inequality because now we have the means to reach out, right? So I think at least that capability to reach out is the first step. But that does not mean it could provide a social infrastructure, right? A physical social infrastructure still is very critical. So I think all of this is exciting, but it also really gives us a lot to think about the basic human needs and truly how we actually are going to live in a connected world, because I think the world is so connected, whether we like it or not. So how do we actually make the best out of it, not just for ourselves, but for the rest of others? I think that's I would like everybody to think about it and contribute that.
Those are great last words. Really appreciate it again. And for everyone listening here, please make sure you like this video. Make sure you subscribe to SingularityNET. And if you're also interested more about healthcare blockchain conversations, listen to my podcast, Health Unchained, as well. Thank you so much, Dr. Eva Lee. Really appreciate this conversation, and I hope you all enjoy this. Take care.
Thank you for having me.